There's a, there are children that were really sacrificed up for the advancement of medicine, and for me, as a sanctity of life person, I can't move forward. I felt like it was impressed upon my heart that it's not just you. So there's this policy put in place for something that could happen versus not getting a transplant, which could 100% lead to the end of my life. This is my life. It has nothing to do with politics. It's got everything to do with what happened to the profession of compassion and care and healing. I feel like that has almost all but disappeared.
I just was wondering if maybe our conversation, if that brought anything else to mind that you might want to bring up that I.
Because they wouldn't let me donate to Leilani, and because now they won't let her have a kidney, that they've essentially sentenced her to death. So last year, without a vaccine, we were given transplants without the vaccine. Why can't we still do that?
We know that COVID causes severe disease in transplant patients, and we know that vaccines, when given after transplant, don't work as well as if they're given before transplant. So I think those two things are really the big driver of this. You also don't want, somebody coming into the hospital who may be incubating COVID, and then you discover that after the donation has taken place, and then there's a possibility of a bad outcome. So I think this is all to try to ensure that living donors have good outcomes and the recipients have good outcomes.